If you've noticed a bony bump growing at the base of your big toe, and your toe seems to be drifting toward the others, you're probably looking at a bunion. The medical name is Hallux Valgus, and it's one of the most common foot complaints I see in clinic. At first it might just be a cosmetic concern, but for many people it gradually becomes tender, especially when shoes press against that bump. The skin over it can get red, thickened, or sore. Here's the reassuring part. A bunion is rarely an emergency, and there's a lot you can do to stay comfortable. In this video, I'll walk you through what's actually happening to the joint, why bunions form in the first place, and the practical options for managing them. To understand a bunion, picture the joint where your big toe meets the long bone of your foot, called the first metatarsophalangeal joint, or MTP joint for short. In a bunion, the long metatarsal bone drifts outward while the big toe leans inward toward its neighbors. That imbalance pushes the joint out to the side, creating the bump you see and feel. So what tips the balance? Genetics play a surprisingly big role. If your parents or grandparents had bunions, you inherited the foot shape and joint mechanics that make them more likely. Loose ligaments, flat feet, and certain inflammatory conditions like arthritis can contribute too. Footwear matters as well. Narrow, pointed, or high-heeled shoes don't single-handedly create a bunion, but they Bunions usually develop slowly over years, and the symptoms tend to track with how big the bump gets and how much your shoes irritate it. The classic signs are a visible bump at the base of the big toe, aching or burning pain over the joint, redness and swelling, and sometimes a hardened patch of skin where the bump rubs. As the big toe leans further over, it can crowd or even overlap the second toe, leading to corns, calluses, or a painful second toe. Some people also lose flexibility in the joint over time. Diagnosing a bunion is usually straightforward from a simple look and exam. A weight-bearing X-ray, taken while you're standing, is the most useful test because it shows the true angle of the bones and how advanced the deformity is, which helps guide treatment decisions. Here's an important reality check. Non-surgical care can do a lot to ease your symptoms, but it won't reverse the deformity or push the bone back into place. No spacer, splint, or exercise straightens a true bunion permanently, and that's okay, because comfort is the real goal for most people. The single most helpful change is footwear. Choose shoes with a wide, deep toe box that don't squeeze the joint, and skip narrow or high-heeled styles. A soft bunion pad or cushion over the bump reduces rubbing, and a gel toe spacer between the first and second toes can ease pressure for some. Roomy shoes plus an over-the-counter orthotic insert may improve comfort if you have flat feet contributing to the problem. For flare-ups, ice and short-term pain relievers can help, though check with a pharmacist. While exercises won't straighten the joint, keeping the foot mobile and the surrounding muscles strong can help you stay comfortable and may slow the march of stiffness. Gentle toe stretches are a good start. Use your fingers to ease the big toe back into better alignment and hold briefly, without forcing it. Toe spreads, where you fan all your toes apart and hold. Wake up the small foot muscles. Picking up a towel or marbles with your toes builds strength in the arch and toes. Rolling the sole of your foot over a tennis ball or frozen water bottle can soothe tension and ache. Calf stretches matter too, since tight calves change how you load the forefoot. The rule of thumb is mild stretch is fine, but sharp pain means ease off. So when does surgery come up? Surgery is considered when the pain is persistent and limits your daily life despite good non-surgical care, not simply because a bunion looks unsightly. Operations realign the bones and soft tissues, and while they can be very effective, they involve real recovery time and aren't risk-free. So this is a careful, shared decision with a foot and ankle specialist about your specific foot. Cosmetic-only surgery is generally discouraged. See a doctor sooner if the joint becomes suddenly hot, red, and intensely painful, which can signal infection or gout. If you have diabetes or poor circulation and notice any skin breakdown over the bump, or if numbness, an open sore, or worsening deformity appears. To recap, a bunion is a slow structural drift of the big toe joint, driven largely by genetics and shaped by footwear. Conservative care eases symptoms but doesn't cure the deformity, and